charge what they do is because they know that if it's not a value enough for you, then you'll get it somewhere else, right? So, and this, we say, oh, well, healthcare is necessary. We're talking about food. You will die if you don't eat today. Well, maybe not today. You will die if you don't eat this week. So this is clearly something that is necessary, right? So the, well, I mean, there's some people that could actually go a week without eating, but we won't talk about that. You know, so, but imagine if instead of the system that we have now for chicken sandwiches, imagine if we had comprehensive chicken sandwich insurance. You pay a fixed amount of money per month for the chicken sandwiches that you're going to need in the future. And in order to try to keep the cost down for those chicken sandwiches, those chicken sandwich providers can only charge you about 10% of what it costs for them to get to procure the things that they need for that chicken sandwich. Now, all of a sudden, chickens cost $1,500. Now, all of a sudden, bread costs $150 a loaf. Now, all of a sudden, all this stuff is way more expensive because they're only getting to skim from the top of what their costs are. And now, because of the labyrinthian insurance system that they now have to run every chicken sandwich transaction through, it now drives up the cost. You go into your chicken sandwich store and you go, let me get a chicken sandwich with cheese. How much is that? And they go, I don't know. What insurance do you have? I have Blue Cross Blue Chicken. Here you go. And they go, okay, yeah. This is the Blue Cross Blue Chicken HMO model. We're gonna have to run this through. We'll send you a bill. We'll find out what they cover, and then we'll send you a bill based on your chicken sandwich network. What on earth makes anyone think this is going to be more expensive? Now imagine if because of this system, no one can afford chicken sandwiches anymore. It's costing a freaking fortune. The vast majority of Americans have to actually have subsidized chicken sandwich insurance and still can't afford it. And so, you know, Colonel Sanders comes in and says, listen, I have a fix for this. We are going to have chicken sandwiches for all. We're going to fix it right we're now going to, from now on, we're at Blue Cross Blue Chicken. I came up with that just now. And we're going to, and now we're going to provide chicken sandwiches to everyone, whoever needs it. And we're going to put the very people who created the regulations that drove up the cost to their direct benefit in charge of deciding what it's going to cost. Now, you're no longer paying for the chicken sandwich yourself, but that same suboptimal way of providing you with that sandwich exists. There is so much money being put directly into bureaucracy and into profit instead of into actual research and dynamic creation of ways to bring down the cost equilibrium so that they get your business instead of someone else. So that now chicken sandwiches are pretty much in stasis. There's not going to be any improvements to the seasoning. It's going to be the same herbs and spices. If you don't like your chicken sandwiches now, that's tough. That's how they're always going to be. And we're creating billions of dollars in additional costs for people that haven't even been born yet, because screw them, they're not born yet.